Hello, this is Frank Miller, MD, coming to you again in my fourth episode of my mental health reform podcast from Western North Carolina. I had originally intended to broadcast on approximately a twice-a-month basis, but in the last 2 months of April and May, I was fairly ill and out of commission. I'm back to fighting and recording and working status. So last week I had a catch-up podcast production, episode 3, covering some progress in mental health reform areas, which I think is important to do. I decided to do this podcast a week earlier so because of the current brouhaha nationwide and conflicting discussions and general information overload on the effect of the Republicans' now unveiled, previously secret behind closed doors, formulated health care bill designed to replace Obamacare, which, as everyone knows, has been one of the major policy goals, initiatives, and wishes of the Republican Party for at least the last 7 or 8 years or so, since Obamacare was conceived and then enacted about 7 years ago under the President Obama's administration. There has been an enormous amount of conflicting information, and my podcast is really not designed to be political, and I will try my very best to stay out of the political weeds and instead focus on, as a physician and psychiatrist and as a person dedicated to the care of my patients, which if that is a politically motivated viewpoint, so be it, but it's not motivated by ideologies from either of the many political parties, including the independents and libertarians, in addition to the main 2 political parties that form the backbone of our checks and balances electoral democratic system. So I'll be an advocate and a hopefully as dispassionate as possible observer, except when it comes to my empathic and healthcare provider and, if you will, do-gooder motivation and mindset for my patients in explaining what I think are relevant and as objective observations and points about the elements and provisions and possible effects in the present form of the Republicans' health care revision proposal. Now, this will be like, hopefully, many other congressional and political legislative processes within Congress and will undergo amendments, revisions, and debate, which we've not seen in the last 3 weeks since this thing was conceived by a select group under a great deal of secrecy, which, of course, has been criticized, but for me, that's neither here nor there. It's out now, and for me, that's what matters. Now we can get a look at it, discuss it, and go from there. But one change that has already occurred just in a few days is one of the things that the bill was criticized for was its probable decimating effect on continued funding for substance abuse treatment and specifically for the opioid epidemic crisis in this country. For instance, it appeared as though only about $2 billion was going to be allocated for the needed nationally preventative and treatment and recovery-oriented programs nationwide, literally in almost every county in this country, for the next 10 years. And just yesterday, it was announced that that part got horse-traded and revised, and suddenly it started to be announced from various quarters, and I heard about it listening on the news just like everybody else, and heard Senator Susan Collins from Maine talk about this, and I was very gratified and pleased to hear that the dollar amount to be allocated to the opioid epidemic crisis was to be $45 billion instead. So I viewed this as progress, and I hope that revisions that will be positive and more middle of the road for everybody, helping with cost containment, rational tax revenue policy, and I won't say anything more about that, except a little bit later, as I probably will get criticized by the tax devotees. In any case, I wanted to talk about some of these issues more specifically and really look at key points of the Republicans' provisions as they affect health care in some areas. Now, as everyone may recall, the Obamacare structure has the individual mandate, which means, simply put, most everyone is required to have some sort of health insurance, and of course there have been provisions for lots of choices in the marketplace, although in the last year or so, with all the uncertainty about the coming possible changes, several major insurance companies have pulled out of some markets, and this has been, of course, seized upon by certain advocacy groups and political entities as hailing the death knell of Obamacare. From the point of view of most healthcare providers, it's simply not the case. I think the uncertainty, as well as most of the rest of us in the healthcare industry, view that quite differently. However, the primary upsetting thing that has come out this week is the Congressional Budget Office again confirmed what was known from the previous Republicans' proposal in the House a few months ago, that again now the figure is 23 million people will likely lose health insurance by various economic pressures and hurdles that will be legislatively enacted, and this will occur over the next 10 years or so. Much of this will be accomplished by cutting of Medicaid spending. Now, this is important because if you don't understand kind of this point, it really is important. Medicaid expansion was one of the major provisions of Obamacare to make it much more possible for folks with mildly higher incomes up into the roughly $50,000 range, but don't quote me on that because it's probably moderately incorrect, but somewhere in that range, which is now, in essence, perhaps lower middle class to middle class level families who had comprised, along with large numbers of the poor, the figure that we had up until 2014, and I think it bears remembering that this was not so far long ago, that it was the census-based truth that 47 million people had been without health insurance. And I remember when this figure came into existence and to be known back in the late 1980s and 1990s, and was responsible for the care shifting to ERs, the spike in bankruptcies nationwide, which did really contribute more to the ongoing, lingering recession. Not as much as the collapse of the housing bubble in 2008, but nonetheless has afflicted hundreds of thousands of families, causing them to lose everything when they get hit with catastrophic illness, have no coverage, etc. In any case, one of the things that the Republicans' plan does is to trim the subsidies in general that help lower-income Americans pay for coverage, and this will have a big effect. The taxes that the Obamacare plan had leveled, and there's a large quarter in this country whose ideology says that, all tax revenue is bad, except, I suppose, for sin taxes and such. To put a little definition into this, individuals making over $200,000 a year and couples making over $250,000 had taxes on them, and these will be stopped. There are also all kinds of financial levies and taxes, especially on capital gains taxes, and I've seen figures of approximately 3.9%. Printed media have to do with profits made on sale and capital gains of profits on stocks and such things, as well as specific levies that were enacted on insurance companies, pharmaceutical companies, and medical device companies. The CBO has stated that the proposed elimination of all these taxes would net $540 billion, and it won't cover or won't equal the amount of $770 billion in Medicaid takeaway funds over the next decade. So if you think about that, it's going to be a double hit on Medicaid and the devoting of funds from the government coffers in order to fund insurance. Now, if eliminating those taxes to the tune of $540 billion resulted in those saved monies being poured into the Republicans' health plan coffers to pay for issues, well, that would be a good thing, I suppose. But it's like many states with their so-called educational lotteries. 15 and 10 years ago when these got started, many states initially devoted their monies to the education system, and then slowly, as the recession hit in the late 2000s, they started grabbing that money and using it to plug holes everywhere so they could not raise taxes. One state I have to compliment is Georgia, who, by and large, from what I understand, has really kept their education lottery revenues in the education system, and it has dramatically, at least 10-tupled the standing of the state university system, upgraded public schools all over, and has enacted this wonderful set of provisions that supports young college-bound adults who are Georgia State residents, giving them fantastic scholarships if they have high grade point averages, and also giving them tuition-free ride if they maintain their grades in high school and in college above a certain level. And Georgia is just exemplary in this and a wonderful example for the rest of the country. But that's kind of a nice aside. Some people know how to do things right and stick to it. One of the things that the Republicans' bill will also hit will be lowering the ability of large numbers of persons to continue to be able to enroll in Medicaid, and that is another goal and policy of this proposed legislation, which is to reduce and roll back the Medicaid expansion, which has occurred in the last several years under Obamacare. This would do this by reducing the income levels of families a fair amount. I've seen different figures, so I don't want to quote any on this podcast because I'm really not quite sure about this, and it's probably going to be a fluid moving target as the bill gets worked on in Congress after the recess. But reducing the federal funding for Medicaid program enrollees and costs to a per capita allotment, meaning per person each state will get so many bucks to them in a block grant. And that's one of the other major policy changes and initiatives contained in this legislation. And this means that overwhelmingly likely many states will reduce eligibility and also